Medicare Part D crisis. How to protect your prescription drug costs. A ticking time bomb threatens millions of Medicare beneficiaries, poised to explode in the form of skyrocketing prescription drug costs. Despite the reassuring 2025 report from the Medicare Trustees, which deemed Part D prescription drug coverage financially sound, the Centers for Medicare Medicaid Services, CMS, is scrambling to prevent a premium crisis for 2026. This urgent action highlights the precarious state of the program and the need for beneficiaries to take. In 2025, for instance, the NAMBA was $179.45, but the actual base premium was only $36.78. Understanding the NAMBA, the key to Medicare Part D costs. The NAMBA is a crucial metric used by CMS to set the costs and subsidies for Medicare Part D prescription drug plans. Essentially, it represents the average cost that insurance plans project for providing basic drug coverage to one person per month, weighted by the number of enrollees in each plan. For the first time, CMS has rejected some standalone Part D plan bids due to excessive cost-sharing increases or benefit reductions. Additionally, the agency has extended its emergency premium stabilization demonstration, which limits premium hikes to $50 in 2026, up from $35 in 2025. The Inflation Reduction Act. A double-edged sword, much of the current turmoil can be traced back to the Inflation Reduction Act, IRA, intended to cap out-of-pocket drug spending for seniors. Key changes include an annual out-of-pocket cap of $2,000 in 2025, rising to $2,100 in 2026. Increased government responsibility for catastrophic coverage. New pricing pressures on insurers. While the cap benefits the roughly 5% of beneficiaries with the highest drug costs, the majority, about 95%, face higher deductibles, increased coinsurance, and fluctuating premiums. According to the Kaiser Family Foundation, KFF, 85% of PDP enrollees now face deductibles in 2025, up from 67% the previous year. Coinsurance, the hidden cost that could break your budget. The shift from flat copays to coinsurance means that some Medicare Part D enrollees now pay a percentage of a drug's retail price, often 25% to 33%, instead of a fixed amount. This change is particularly impactful for non-preferred and specialty drugs. For example, consider the blood thinner Eliquis, which can cost over $700 a month. With a 25% coinsurance, the monthly cost would be about $178. And with 33%, it would be around $235, significantly higher than the typical $47 copay for a preferred brand. While most plans still use copays for Eliquis, retirees need to be aware of the potential financial exposure from coinsurance on high-cost medications. Federal interventions. Temporary band-aids on a larger problem. To prevent premium shock, federal interventions are stepping in. However, the automatic financing model, which relies on Treasury transfers to smooth out costs, is insufficient to stabilize the market under the IRA's new design. Beneath the surface, the troubling reality behind stable premiums. Although the average 2025 standalone Part D premium dropped to $39 a month, this stability is artificial, supported by temporary subsidies and bid caps. Behind the scenes, plan choices are dwindling and market concentration is growing. The top 5 firms now control nearly 3/4 of enrollment. Low-income subsidy decline, a shrinking safety net. Low-income beneficiaries are also feeling the strain. Enrollment in the low-income subsidy LIS program fell from 13.7 million to 13.1 million in 2025, partly due to Medicaid unwinding. Fewer people are protected from the volatility. The new Part D reality, volatile premiums and fewer choices. The new landscape of Medicare Part D is characterized by volatile premiums, higher deductibles, and a market increasingly reliant on emergency federal action. Your action plan, protecting your Part D costs during open enrollment. Open enrollment for 2026 coverage starts on October 15th, and inaction could cost you dearly. Historically, most beneficiaries stick with the same drug plan year after year, but this complacency is now risky. The Reshop Imperative. Why annual review is essential. Medicare beneficiaries must reshop their Part D drug plans during open enrollment this fall, advises Mary Beth Franklin, a certified financial planner and Medicare expert. Make decisions based on your specific drugs and dosages, not last year's premium. Practical steps for beneficiaries. 1. Review your annual notice of change, ANOC. Plans will send these in September. They detail changes to premiums, deductibles, formularies, and pharmacy networks. Even minor adjustments can have significant financial implications. 2. Use the Medicare Plan Finder tool, available at Medicare.gov starting October 1st. This tool helps you compare total annual costs across plans by entering your prescriptions, dosage, zip code, and preferred pharmacy. Focus on total out-of-pocket costs, not just the monthly premium. Navigating fewer choices. The impact of market consolidation. With fewer plan options, the margin for error is smaller. As noted by Melinda Coghill, co-founder of 65 Incorporated, we had an average of 22 plan options at the end of 2024. In 2025, there are just 14. Real savings, what you could save by comparing plans. Switching plans can lead to substantial savings. Coghill reports that some clients have saved an average of $8,000 by changing plans, with extreme cases saving over $100,000 over time. Assuming that a plan that worked for you this year will work next year is a mistake, she emphasizes. Seeking professional guidance. When to get help. Professional advice may be harder to come by. Several major carriers have reduced agent commissions for Part D plans, making free expert assistance scarcer. If you need help, schedule it early or consider paying a professional for an independent review. Consider buying prescriptions off plan. While having a Part D plan is generally beneficial, you don't have to use it to pay for your drugs. Marcia Mantell, president of Mantell Retirement Consulting, suggests checking off-plan options like GoodRx, SingleCare, AARP's discount drug card, Amazon, and Mark Cuban's Cost Plus Drug Company for potential savings. Don't forget Part B premiums, another cost to consider. In addition to Part D changes, standard Part B premiums are expected to rise sharply in 2026. Factor the combined cost of Medicare into your budget. Why this matters to you. Medicare Part D is entering a period of unprecedented volatility. Federal interventions are providing temporary relief, but the underlying market remains fragile. For most beneficiaries, the best defense is active participation during open enrollment, comparing plans, understanding coinsurance exposure, and ensuring your plan meets your needs and budget. Failing to act could make 2026 the most expensive year yet for your prescription drugs. But here's where it gets controversial. Should the government do more to stabilize the market? Or is it up to individuals to navigate these changes? Share your thoughts in the comments. Understanding Medicare premium increases. What you need to know. Millions of Americans are about to face a harsh reality. Medicare prescription drug costs are climbing again. The Centers for Medicare Medicaid Services, CMS, just confirmed Medicare Part D premiums will jump to $38.99 monthly in 2025, a nearly $3 increase from last year's $36.78 rate. But here's where it gets controversial. While the Biden administration claims to shield seniors from financial strain, critics argue systemic flaws in current policies are forcing this very dilemma. The government's formula for calculating subsidies, the national average monthly bid, is skyrocketing even faster, leaping from $179.45 to $239.27. In response, CMS says it's fighting back with unprecedented scrutiny of insurance providers. For the first time ever, the agency rejected certain Part D plan bids outright, targeting insurers proposing market outlier premium hikes that far exceeded regional competitors. We're holding plans accountable, CMS declared, citing negotiations that forced some insurers to revise their proposals. Here's what most people miss. a critical safeguard from the Inflation Reduction Act IRA, caps annual premium increases at 6% through 2029. Yet this safety net comes with a twist. To soften the blow, the Biden team created a voluntary premium stabilization program last year, essentially paying insurers billions to limit price jumps. The program initially cut base premiums by $15 across all plans. But now, under the Trump administration's adjustments, that cushion shrinks to $10 in 2026. Even more divisive, the maximum allowable premium surge for individual plans jumps from $35 to $50, and insurers lose flexibility to adjust risk corridors. Republicans have slammed the stabilization effort as a $5 billion Band-Aid for what they call the IRA's structural flaws. Meanwhile, CMS reports Medicare Advantage premiums will drop slightly to $17 monthly, a rare bright spot. But with federal payments to Part D plans ballooning to $6.2 billion, taxpayers might wonder, who's truly footing the bill? This raises critical questions. Is subsidizing insurers the best way to protect seniors, or does it risk creating long-term dependency? And why did CMS approve some double-digit premium increases despite the 6% cap? Spoiler, the cap applies to average increases, not every individual plan. Love it or hate it, the stabilization program isn't disappearing. Insurers must decide by August 4th whether to stay enrolled, with final 2025 rates due in September. One thing's certain, as premiums creep upward, the debate over balancing corporate profits, government intervention, and senior affordability will only intensify. So we ask you, should taxpayers fund insurer subsidies to curb premium hikes? Or would that money be better spent directly helping seniors? Let's discuss in the comments. Trump versus Biden, Medicare drug premiums and what it means for seniors. Here's a twist in the ongoing debate over healthcare costs. The Trump administration is quietly continuing a policy it once criticized as wasteful. Last year, Republicans were quick to attack Democrats for subsidizing monthly prescription drug insurance payments for seniors. Yet, in a surprising turn, the Trump team has now told insurers to keep this very same policy in place. This revelation raises a big question. If the policy was so bad, why is it still being used? But here's where it gets controversial. The Biden administration completely overhauled Medicare's drug payment system, capping seniors' out-of-pocket costs and allowing the government to negotiate prices for expensive medications. For example, this could mean seniors no longer pay full price for drugs like insulin or specialty treatments for conditions like rheumatoid arthritis. However, some critics argue that government price controls might discourage pharmaceutical companies from developing new medicines. And this is the part most people miss. While Democrats frame their changes as a win for seniors, the Trump administration's decision to maintain the previous subsidy system suggests a deeper ideological divide. Should the government play a role in negotiating drug prices? Or does that risk stifling innovation? We want to hear your thoughts. Do you think this policy helps seniors or hurts medical progress? Share your perspective in the comments below.